Welcome back to Health in Today's Woman. Tonight we're taking on a disease that really does have a large impact in America, and it's the idea or the disease of autism. Now, to help me better understand this, I have Dr. Javier Valero, a pediatric neurologist at the Murfreesboro Medical Clinic. So Javier, I want to thank you for coming back. And I want to talk to you a little bit about this because I think something that's very important. You can't have this discussion about autism without mentioning the evidence-based idea of vaccines. Because I think when anybody talks about autism, the first thing that comes to the discussion is the whole idea of vaccines. Give me a little bit of your take on the evidence as far as autism and vaccines.
Still is a great debate, and there is a lot of controversy on that topic, but there is no proof or hard evidence that of cause effect between autism and vaccinations. And I think that you heard recently in the last 3 or 2 months, the study on Lancet News from the UK, where it's not clear the big study that link vaccinations with autism. Some of that data is not clear if it's truth or not. Then there is no proof that vaccinations cause autism. Several studies right now are being run by the CDC, Centers for Disease Control, and if people want more information, they have a web page dedicated for vaccinations. Then I believe and I think that still children need to be vaccinated, and there is no proof that vaccinations cause autism. But it's a debate.
And I think the big issue too I've always heard is you mentioned that these kids can be diagnosed very early, and so they're being diagnosed a lot of times at the time when vaccination is being given. I mean, we're talking about 8 months to 3 years in the time. That's when most kids are getting vaccines. And I've heard a lot of the arguments is a lot of it is that's when the diagnosis is showing up at the very same time as we're giving the vaccines. Do you agree with that?
Yes, and that's the core and that's the key for this discussion and for this controversy. In some studies, like the UK studies, it's not clear if the symptoms start before the vaccine or after the vaccine. Then that's why it's difficult to make a cause-effect relation between autism and vaccines. It's not clear yet.
Now here I want to make a little bit of a turn because I want to talk a little bit more about treatment. And one of the things I want to mention to you, because I think it's important, is that this is a multifactorial disease. I think we've mentioned that on numerous occasions in this show. One of the things I want to get to, though, is the treatment is also multifactorial and multidisciplinary. Where do you start? Where do you kind of begin? You said you go to the pediatrician. Pediatrician notices something wrong, sends them to you. Where do you take up the process from there?
Yeah, once we get the referral from the pediatrician, I want to make sure that we are talking about the behavioral or the autism and try to differentiate from any organic disease, or make sure that the patient is not having any organic process infection or brain tumor or any brain structural abnormality or any metabolic condition that can mimic autism also. Then we can run, depend of the symptoms and the severity of the symptoms in the patient, we run sometimes brain MRIs or very small metabolic or chromosomal genetic studies. And we used support from the psychologist. I am in contact with the Vanderbilt Kennedy Center, and they have psychologists that provides diagnostic tools, and they can help us with achieve the diagnosis and classify these patients within the spectrum. Asperger's or classic autism.
And once we get there, we've got our diagnosis. Do they also help you with the treatment as psychologists? Are they helping with the treatments and the? I know there are many different things. Describe to me some of the treatments that are out there.
Yeah, the treatment, as you mentioned, is multifactorial also, and one of the key components is therapy. Applied behavioral therapy is a part of the treatment. Positive reinforcement, and that's one part of the treatment. Also, we get support from the school system. a good environment in the school with physical therapy, occupational therapy, and speech therapy will help these patients to get more socially involved and to help in the speech. Also, we handle some medications, pharmacologic treatment that in any way is a cure for autism, but sometimes can help with the behavior and can help some patients that are very hyperactive. Some medication can modulate the mood and the behavior. There are other treatments that are not FDA approved, and you see in the internet there are people in other states that are doing a hyperbaric chamber treatments. That is basically high oxygen concentration chamber. There is no clear data that this help in autism, but in some states, insurance cover these treatments, and people are getting these treatments.
This is such a devastating disease, and I'm glad to hear that we have some treatments, especially some medical treatments. We'll be right back. We're going to be joined by a patient of mine who has a daughter that had autism. We'll be right back after these messages.